It can be quite heartbreaking to meet with a family and they have a child whose tantrums are so severe that they're impacting their ability to stay in school. They're impacting the safety of the child and other family members, and certainly impacting the belief that this child can thrive as an adult in the future. I mean, you can imagine the worries and fears that parents can have when they have a child who is dangerous even at a young age. Many of these families have tried many medications. Their children may have been in and out of the hospital. What continues to surprise me, and I've been using the Walsh Research Institute protocols now for 11 years, is that tantrums in young children is one of the easiest to treat from a nutrient imbalance perspective. We can usually predict it's going to be primarily due to high copper or copper overload, or it's going to be due to elevated pyrrole. Now, if a child has sort of an oppositional defiant piece to it, then they may be what's called undermethylated. But for the child that doesn't have that and has regret and remorse after they have one of those episodes, it's very often high copper or, again, high pyrroles. Both of these imbalances have other traits and symptoms, so we can usually predict which one it will be. And many people will have both. High pyrroles causing low zinc, and then low zinc contributing to high copper. Zinc keeps copper in check. So when we see such children and look at symptoms and traits of the different imbalances, as well as assess for a gut microbiome issue. Do they have sources of toxicity? Are they experiencing trauma? Did they have attachment disruption? We consider all that, but the likelihood still is that they're going to have high copper and or high pyrroles, and they may or may not have undermethylation if they have that oppositional piece. So we do labs, check for pyrroles. They may be elevated, and check for copper, zinc, and whole blood histamine to assess methylation. And once we have that information, if someone has high copper, they will be on targeted nutrients to help bring their copper down. And if someone has high pyrroles, they will be on a nutrient protocol to bring the pyrroles down. People tend to respond fairly quickly to a pyrrole protocol. Copper, depending on how high it is, can take a little bit longer.